This is Helen, and Helen's going to show us how to release our plantar fascia, tibialis posterior, quads, hamstrings and piriformis, all with a spiky ball. Okay, so the first thing we want to do is to say that we're going to release with awareness. So that means really thinking about the bit that you're releasing. So pop your foot on the ball, that's the one, and then I want you to just shuffle it around until you find a bit that's tender. Go right under the navicular to really get into that tibialis posterior, that's the one there, so right into the arch. And then she's going to find a spot that's tender and then really try and relax her foot and mould her foot around it and really focus on trying to let that go. You're going to really breathe into that for 5 to 10 seconds and then move on and roll it around and find the next tender spot. And you're going to do this in total for about 45-50 seconds, maybe a minute, just finding the sore spots. That's it. That's nice, really relaxing into it. So we're really freeing off that tibialis posterior, which is going to allow her subtalar joint to have a lot more control. Good. And just wiggle that out, give us some ankle circles off the ball. That's it. Beautiful clicking there from your subtalar joint there, Helen, thank you. Great, so that's just allowing a bit more movement and control in her subtalar joint. She's now going to move up to the bed, where she's going to use the spiky ball to show us how to release quads and hamstrings. So quads first of all. So she's lying face down and she's going to place the spiky ball underneath her quads, so under the front of the thigh, above the knee. Good. She's going to find a spot that's a little bit tender, and when she finds a spot that's a bit tender and tight, she's going to hang on there. And then she's gradually and slowly going to bend her knee up to increase the stretch over that tight part. Good. And then when she brings her back down again, what she'll find is that that area is just released. If it's not released, she can do the same thing again. She's then going to move it up to another tender spot, find that, and then she's going to bend her knee again. That's it. Now just watch how her core stays really controlled throughout that. There's nothing else moving. Everything else is staying completely still. The only thing moving is that foot. Good. Moving it across a little bit to find the outer quads. That's great. You can rotate your body slightly so that you really catch the outer side. Get all your weight through that ball. Bend up. Good. And then come down and really feel that release. Lovely. Moving on to the hamstrings now. I'm going to get Helen to demonstrate this on her other leg just so that you can see it more easily. So left hamstring, actually no, that's fine. Right hamstring's fine. Yeah, that's good. I'll come around. So Helen's going to place the ball underneath her right hamstring. So the hamstring goes up right from the knee up to the butt. So she's going to get right into the belly of the hamstring. Good. And then just as she did before, she's going to find a sore spot, and then this time she's going to straighten the knee to stretch out that hamstring. Nice and slowly. Good. And then drop back down. Okay. If she feels that's released, she's going to move on to the next spot. If she doesn't feel that's released enough, she's going to do it again. So up she goes. Stretching out, stretching out, stretching out, good, and back down. Now if that doesn't feel like it's getting enough stretch, the other thing that she can do is to bend forwards from the hips. So she's not going to drop her head and slump. What she's going to do is just create a little arch in her low back. That's it, good. Notice how she's keeping her back straight there as she brings the knee up, so she's not just dropping her head. Okay, that's good. Nice. And down she comes. So we're going to assume now that she's released her entire hamstring, and she's going to move the ball up now, so that it's underneath her piriformis muscle, which is in the outer part of the buttock. That's it. So the ball's now there. Now what we're trying to control here is hip rotation. So the way that Helen's going to do this is she's just shifted all her weight onto her right buttock so that she's really getting the ball in deep, and now she's going to rotate her hip. That's it, to really stretch out that piriformis, and back down. Find a different spot. Up she goes. And back down, and that's a release with awareness, because constantly she's thinking about where is that tightest and where can I really get that stretched off. Excellent. So she's now released off her subtalar joint, her knee via the quads and hamstrings, and she's released off her hip, and she's going to feel that that knee's in a much more comfortable position. Good. Video off.